The school year is back in full swing again, and that means, the busy schedules return, the sports practices, lots of homework being brought home at night. It brings a lot of stress and anxiety for really any student and their families, but especially students living with ADHD. Here to talk about some strategies to help with ADHD struggles at home and in the classroom is Dr. Zoe Martinez with Done.com, a digital health company for psychiatric chronic care management. Dr. Martinez, thank you so much for being with us this afternoon.
Yes, I'll let you. Really briefly, I am board certified in both adult and child and adolescent psychiatry, so I have a lot of experience treating ADHD across the lifespan. And now I'm going to let you ask me questions.
Okay. It's interesting. I was just talking with an adult recently who recently found out that they had ADHD. I think that there, may be a lot of families where the child, it hasn't even been recognized or given a name. What are some of the things that, either parents or teachers can be on the lookout for in a child who hasn't been diagnosed?
So I think teachers are very good at picking up the disruptive behavior. So the kid that's jumping around, making, whatever, class clown, making fart noises with their elbows, that kind of stuff. It's more the kids, and the quiet kids who aren't getting their work done. They seem they're smart, but they don't turn in their homework. They don't do well on tests. They always forget their backpack or their jacket. I think those are the kind of both kids and even adults that we're trying to help and recognize the inattentive part. So the quiet, well-behaved individuals who don't always get picked up.
Yeah, that's interesting that you mentioned that, because it does seem like, the first group you were talking about there immediately gets flagged, maybe not members in the second group there. And I'm curious how it can exacerbate problems if that isn't recognized and flagged immediately, that, maybe then this child is, punished or, told, hey, you're not getting your stuff done, this isn't acceptable, et cetera, and no one's even aware what's going on, and that just makes the situation even harder.
So I tell people, I work with a lot of families, to say that if someone mentions that, don't take it the wrong way. But yes, the problem is that those people that are youth of whatever age and even adults, they internalize that, like, I'm not that smart, I'm not that good at this. So I work sometimes with adults who never were identified. They get a job promotion, all of a sudden they're not good at their job, and they just think, I'm not very smart, I'm not very organized, I'm not very good. And kids start that even from early on. If you're not the kid that is creating a disruption, you just start to think, hey, maybe I'm not that good at school. And that's the last thing in the world that anyone wants.
And the real tragedy, it would seem there too, is that, people may live with this. They may recognize some signs and symptoms in themselves and just not say anything. The tragedy in that is that there are therapies available that can really help.
Yes. I know that people worry about medications being the only answer. They are one answer. They are not the only answer. There's a lot of school-based therapies. There are even accommodations in college and at work that just give people more time, that allow them even simple things like kids are allowed to have fidgets, like little things to play with. So it's not all about medicines. And I am a child psychiatrist, so a lot of my job is to prescribe medicines. But that is not the first thing I go to at all. So the first thing is to know what's going on and figure out how to help.
So professional help is huge. Before we let you go, though, let's talk about those parents and let's talk about those teachers, the guardians, and so forth. How can they best support children with ADHD?
So I would say the first thing is to reach out to anyone. It does not have to be a child psychiatrist. It doesn't even have to be a therapist. Start with your pediatrician. Start with your family practice doctor. A lot of them actually know about ADHD. There are rating scales that are free, pieces of paper that you can have the parent, guardian, and teacher fill out. Just start with trying to figure out if that's what's going on, and don't think of it as a negative thing or a failure. And once you have that in place, then you can ask the school for help. It does not have to be all about medicines, which I know people worry about.
But take a step, for sure. Don't just ignore it. ADHD expert clinician Dr. Zoe Martinez with Done.com. Thanks again for being with us today. We really appreciate it.
My pleasure. Have a good day.
You too. Thank you.